We use the right-based approach in delivering our mandate of making sure that the community participates in the development of their community. And we do the through information sharing, capacity building, policy advocacy. We live in a patriarchal society where the decision of one sex is not as important as the other. And we felt that there is need to bridge that gap, to bring about equality and equity, to bring about justice, because any community that is not bettered on justice will not survive. And so because of that, we felt that we need to create a platform where we have an opportunity to interact with the community people. And we've been doing that for the past 16 years, working with community structures, changing the narrative of inequality, and making sure that we amplify their voices to be able to respond to issues of gender-based violence in the community, economic disempowerment.
Wrahp trained more than 3,000 men to know what they are doing. When we were trained, the Lagos State government wrote the law. We understood the law. We know what the law means. We can interpret the law, and they don't take law into their hands. They report cases.
Innovative Resource Center, which is a psychosocial support center for the protection and response to issues of sexual and gender-based violence in Alimosho communities and Lagos State as a whole.
The Resource Center was established in March 2020 and launched in September 2020. Over this past 2 years, we have recorded a total number of 823 cases of SGBV. This center is a service delivery center where members of domestic violence advocates are free to report issues that have to do with child abuse, domestic violence, like a safe space where survivors come with comprehensive psychosocial support.
I was sexually abused at the age of 16 in 2020. I was rescued by a team. They made sure the culprit was arrested and was charged to court. They have done a lot in my life that I can never imagine. I'll forever be grateful.
Reported cases are treated with utmost confidentiality, and through a case management process, all cases go through the counselor, the psychotherapist to ensure that they receive psychosocial support, psychosocial first aid, counseling, therapy, and relaxation techniques.
Thanks, Wrahp, for what we have done to us, for the teaching they taught us. We taught of sexual violence, the causes, the consequences, and the prevention. So we know that this teaching we taught now, I'll be able to participate after him. So thank you, Wrahp, for teaching. I love it.
The Team Resources Center have really impacted in the life of people with disability, most especially women and girls with disability. About 50 people have benefited from the resource financial empowerment or skill empowerment.
Been at the forefront of advocating for and advancing women's rights and health issues in Nigeria, especially in Alimosho local government. And this is sending URA, the organization, the leaders, fellow board members, staff, and every beneficiary of the organization a goodwill message and encouragement to the organization to even push further, push harder, and do more.
It could be purple curtain, it could be camera. You can stay anonymous and not put your name, but we need some word in there.
Hello, my people. Now, I don't want to community. Let my guys go get ready for last day. I mean, they go end here now. Issue like child abuse, rape, maltreatment, domestic violence. Husband they take care of wife, wife they take care of husband. Now they maltreat my children. Now they do not make any. Put now reports. So, Creative Resource Center. Just go your make it www.ncare.ng. I don't finish with that, so you will start the report. Before you don't respond to that.
I will advise the government and everybody in Nigeria to come together to support this vision with money, because then we must get a land where we will build the Retin Resource Center.
The work is just starting, and we use this opportunity to ask the well-meaning Nigerians to support the center because there's a lot. We also empower women in the center.
The level we are now is making sure that the resource center is constantly being supported. And we can only do that by encouraging the community to take action. So this is an action call.
Thank you so much for being here today. It's such a privilege to be with all of you. So many of us have been coming to the CSW for so many years and have seen sort of the journey. And so thank you for being sisters and brothers in arms. Thank you for all the work you do, and thank you for your leadership. Today we're here to learn, think, and discuss community mobilization, transformational advocacy, and systems change with a systems perspective. I had the privilege of going to Lagos, Nigeria, and spending time with Wrahp', with Madam Bose here, with her team who is here, and really seeing firsthand the transformational work that they're doing in the community, with the community, and for the community. I have done violence against women and girls work all over the world, and I am just so moved by the model that they're using, the transformational systems thinking model. It's really powerful and it's working. And so today we're here to learn more about this model. We're also going to learn more about gender data in this context, and we're going to learn more about safeguarding, which I think many of you are becoming more and more familiar with, and how all of this fits together in just a wonderful, holistic approach. So gender equality and the advancement of women's rights are fundamental. Human rights are essential to achieving global sustainable development, as we all know. Over the past several decades, significant strides have been made in improving women's access to education and healthcare, increasing their participation in leadership positions, and fostering economic independence. Global frameworks, such as the CEDAW, the Beijing Platform for Action, and the Sustainable Development Goals, have played pivotal roles in driving these changes. However, despite these gains, gender inequality remains entrenched, as many of us know, in many regions, with women and girls still subject to discrimination, violence, and restricted access to justice. In recent years, resistance to gender equality has intensified, often driven by deeply rooted cultural norms, political instability, and economic crisis. These forces threaten to undo the progress made and roll back the hard-won rights of women and girls. In this context, it is not only critical to safeguard the achievements that have been made, but also to actively confront and dismantle the forces of repression. Achieving this will require coordinated action from all of us in this room, from governments, civil society organizations, international agencies, and local communities. This session aims to provide a thorough understanding of the current landscape of gender equality and women's rights by examining the global, the national Nigeria context, and local Lagos state context, while highlighting both the progress and the challenges faced by the Women's Rights and Health Project, or Wrahp'. So before I introduce our incredible speakers, I would like to also welcome everyone who has logged in online today. Thank you for being here. We ask that everyone keep your video and audio on mute. And we ask that everyone here please silence your cell phones, both in this room and in the Zoom room. So I'm just going to wait 5 seconds to make sure everyone has an opportunity to silence your cell phones, both here in person and in the Zoom. While you're doing that, there is a QR code. Hopefully you all have it here in the room, and online it is in the chat. If everyone in the Zoom room could please check your chat and find the QR code, and please fill in your details for attendance. This is really helpful for us. And we please ask that you just take 10 seconds to do this. It goes a long way in terms of keeping track and following up. So now I will introduce our speakers, and I'll give you a quick background on me. So my name is Vidya Sri. I'm founder of Ganga Shakti and co-founder of Tekwan Labs and Every Woman Treaty. I work currently at the intersection of human rights and technology to develop evidence-based interventions for issues disproportionately impacting women and girls. As the founder of Ganga Shakti, I developed a community-led innovation model to help conduct groundbreaking research to address gaps in marginalized communities, specifically on the issue of forced marriage here in the United States, at a time when there was no working definition and there was tremendous denial that it even went on here. So that's where my journey started. I moved on to becoming a co-founder of Every Woman Treaty and did that work for a very long time with some of you right here in the room and on the panel. I know many people are involved in that effort, and thank you for being involved. So that's me, a little background on who I am. And now I'd like to introduce you to Bose Ironsi. Bose is a feminist, activist, social worker, human rights, and community health advocate with over 30 years of dedication to social justice at the grassroots level. As a trained nurse midwife with a BSc in human psychology and a master's in social work, she has combined her academic background with hands-on activism to drive systemic change nationally and internationally. In 2007, she founded Wrahp'S, the Women's Rights and Health Project, to promote women's health, rights, and development using a rights-based approach. Under Bose's leadership, Wrahp'S was selected as the local affiliate partner for the Safeguarding Resource and Support Hub, Nigeria. Wrahp'S mentors 50 community-based and local women's rights organizations, strengthening their capacity in SGBV case management and advocacy. Her work has reached over 2 million community members with crucial information on sexual reproductive health, violence prevention, and leadership. All of these have earned her the title Mama Community. David Richards holds faculty appointments at the University of Connecticut in the Department of Political Science and the Gladstein Family Human Rights Institute. His research focuses on violence against women, torture, law, and human rights measurement. His most recent study is Public Acceptance of Gender-Based Violence as Torture. In the Journal of Human Rights, 2025. David's book, Violence Against Women and the Law, offered original data indicating the strength of laws addressing 4 types of violence against women in 196 countries. It's a great read if you haven't read it yet. I highly recommend it. Allowing for empirical examination of many hypotheses, including whether international law drives the enactment of domestic legal protections. He is a co-founder of the CIRIGHTS Human Rights Data Project, which provides annual data on the level of government respect for 30+ human rights in over 200 countries from 1981 to now. These data have been used by international organizations and in over 170 countries by governments, media, activists, businesses, scholars, and students. Welcome, David. Theodoro is the national representative of the FCDO-funded Safeguarding Resource and Support Hub project in Nigeria. She leads the national delivery team and has achieved over 100% success rate in the delivery of the RSH program in Nigeria across the set objectives. She is dedicated to improving the policies and practices of organizations in Nigeria to keep people, especially women and girls, safer. To strengthen her knowledge for improved service delivery and impact, Lucci is currently undergoing her master's program in Women and Gender Studies at St. Mary's University, Halifax, Canada. She is passionate about promoting the well-being of women, girls, and other vulnerable groups. Her research interest focuses on marriage and migration and their intersecting issues, including cultural and socioeconomic factors and gender-based violence. With this, I turn it over to Mama Community.
Thank you so much. I'm happy to be here, and I'm so proud to see everybody coming to listen to what we have done over the past years. And I want to go straight to the point because I know that this is a very good environment that everybody wants to listen to. Generally, I don't need to stress the fact that globally we have had a significant improvements, or how will I say, a proper way of responding to issues of women. We have had the CEDAW, we have a lot of sustainable development goals, and all this is towards, making women more comfortable in their environment. But however, women's rights and health project was vetted with this whole notion about thinking globally and acting locally. And I felt that there are two major areas that we need to speak to, and that is the women's rights and their health. If you take care of the rights of women, you're also speaking to their health. And when you take care of the health of women, the nation is good for it. So over the past years, we have the vision of having a just society where the dignity of women, young people, and communities is respected, and they enjoy sound health and maximum self potentials. And we do this through, through information sharing, capacity building, and advocacy, strategic advocacy. And so for the past years, Wrahp, I'll go straight to our, our three critical thematic areas. One is the sexual and gender-based violence prevention and management. Over the years, Wrahp has done a lot of, our entry point has always been take the law, because the ignorance of the law is not an excuse. If you don't know the law, you will just be wondering. And so what we have done is to engage community with the law. You hear the young man there talking about Lagos State, the thought of the law, and we run with the law. Yes, it is very critical, and that has changed a lot of mindset about the way people see women, because they know that there are laws that protect them. And so, in the past year, under the SDDB and management, we have reached 826,000 via awareness creation across 3 states in Nigeria. Wrahp is based in Lagos, but we have other offices in 2 other states, involving men and women and communities. And then we have also reached via capacity building about 20,000 community advocates and response and prevention. The guy who was in that is one of them. He is a leader of the whole district, but he's very conscious about talking about issues of women. Then we, after several years of simplifying the various laws and transcribing it into the local languages, we realized that there is need to create a safe space for women. And so, and then we were getting issues about not getting justice as what we wanted to see. So we have been able to reach about 1,580 survivors with legal and psychosocial support services. Survivors supported in the N-Care app. So it became a holistic, we needed to carry out a coordinated approach of response. It's not just enough to create awareness raising or making them to speak with their voices, but how do you deal with the issues when they come? So, and beyond having the Ireti Resource Center, we also established what we call the N-Care app, which my sister here was, party to that, in establishing that. Ireti Resource Center was established in 2020 and launched on the 3rd of September. And is a platform that provides a safe space and various psychosocial support services for survivors of gender-based violence, person living with disability, and it's offered various free services for 1,589 survivors and gotten convictions for 2 perpetrators for sexual violence. I must say that in the environment where we came from, yes, the laws are there, but implementation has always been the issue. And it takes a lot of it. Right now, I have almost about 50 cases in court, and we are still, going back and forth as to how do we get justice. So on the women's rights area, we have 80 community women benefited from the Wrahp'S Women Economic Empowerment Scheme. We also realize that economic empowerment helps the women to take decisions within their home. If you are economically empowered, you can take some decisions, and that decisions that affect you. So we have had 8 community women benefited from that. And we have also sensitized 421,000 more community members on economic, legal, and social rights of women. Because we, in our resource center, we see women coming to say, my husband said I shouldn't work. It's his responsibility to provide, and yet he cannot provide. And so you see conflicts, you see the children not going to school, and you see the woman not able to also put her own contribution to the, to the community. Wrahp as an organization have also participated in joining advocacy with other women rights organizations in Nigeria to push legislative actions on 5 gender bills in Nigeria. So what have we done? Like I mentioned, we simplified and printed 50,000 copies of the DB law in Lagos State. And we also simplified and disseminated 20,000 violence against persons prohibition law in Edo State and Ebonyi State. The law is always is a way of empowering the women, empowering the community, and making sure that the men understand that there are laws that protect women, because they tell you, he's my wife, and then we say there is a law that protects the women. And then we have also simplified and disseminated 5,000 copies of the FGM law, and we printed 5,000 copies of the Lagos State Simplified People's Law. Sexual and reproductive health and rights issues, 20,000 women, young persons sensitized on access to youth-friendly centers. Youth-friendly centers, you see students coming in to ask questions as simple as, I didn't tell my mom I was menstruating, and now she's responding to me that probably I'm wayward. So information with the students coming in, other youth coming in to look for information, it's also has been very helpful. Then we have had also contributed to 3,000 contraceptives distributed among the community. Institutional support system. We have 12 community-based organizations supported system strengthening. What do we do? How did we come about that? We have 12 local women rights organizations whom we have interacted with, and we realized that they really don't have structures in place, and there was need for them to have system strengthening for them to be able to get other funding. And then we have 20 community-based organizations supported with development of their key policies, like fundraising policy, or helping them to organize their board system, making sure that all the systems, all the organizations' policies that will make the organization strength will developed. And then we mentor and coach 3 organizations. And then right now we are having 15 local women rights organizations trained on mandatory reports, because we believe that if we engage the women, it's been said all over in this meeting that when you put resources and engage women in addressing the issue that concerns women, then we are in for success stories. So other achievement is that we established the Unity Resource Center, which provided safe spaces for women, and co-developed NCAP response app. I think my sister is going to talk a little bit more about that. And then we built strong partnership with over 120 organizations and networks. We selected, recently we were selected as the local athlete partner for safeguarding resource and support hub. Talking about safeguarding, you cannot be talking about sexual and gender-based violence without mentioning about safeguarding. Because before a woman is sexually abused, most times, And we all know that this happens within the close family, and maybe sometimes in the office space, there's usually a form of harassment. There's intimidation one way or the other. And then if we can nip it at that at that level, we might have to say goodbye to sexual violence in some settings. So, Ireti Young Leadership Program is another strategic program that we have put in place. You heard that young child say something about, no, Ireti has trained them, they have made them to be able to. So we go to schools, we have been able to reach almost about 70 schools and engage students, catching them young, the ability to make sure that they understand the information, how to run when there is danger, who to report to, what to do at that very age. And you will be amazed the kind of response. And I need to share this story. The first response I got from a 7-year-old child that says, excuse me, ma, is this your number? I said, yes. I said, my father has started beating my mother again. And that made us to respond. And I saw in that child, because we were able to touch with them, they were able to reach out to us. So that is also something that we are doing at the community level. So what am I recommending? There is need for gender issues to be mainstreamed at the state, federal, and global level. Beyond that, we need to enhance access to opportunity, especially at the grassroots level. There is nothing that is going to be happening at the global level if we don't mobilize the women at the grassroots level. We need to forge multi-stakeholders partnership to accelerate the enactment and full implementation of law that protect women's rights, promotes gender equality, ensuring accountability mechanism and national and local levels. Because if we are not accountable to the community people, funders give us money, a lot of people are interested in doing, but we must be accountable to. And then strategic positioning of women and girls to close the digital gap to ensure no one is left behind. We're talking about AI, we're talking about how many people have access to this information. So for us not to leave the women, the girls behind, we must start with them in engaging them. And then we need to leverage technology to develop and implement gender response intervention. And that's why you have the NCARE. But not just having the NCARE, but making sure that those gender responsive implementation. And of course, we know that there is a high level of internet, how would I put it? Yes, internet facilitated gender-based violence. It's becoming very high, where students, young girls are asked to expose themselves and they put their new pictures out and they are threatened if they make any mistake, say anything, and then they are going to abuse. That is coming so strong in our various communities. Promote community-led approach for sustainable impact. Protect women human rights defenders. And that is also coming very strong. We human rights defenders are at risk of what we do because we are interrogating what people think should be normal. We are interrogating the norms that are working, that are very good with the community people. Then creating more safe spaces for women. I must tell you, on every day, even on Sundays when we are supposed to go to church, you see women telling you, I'm in your office, please come and rescue me. So we need to create those safe spaces for women. So going forward, we will continue to collaborate with partners and the non-state actors to ensure a robust and holistic framework for women and girls. We will continue to promote community-led approach. That is very crucial for sustainable impact, including engaging with men. Through Wrahp, Women Economic Empowerment Scheme, we will continue to empower women to be financially and economically independent. We will continue to prioritize the rights and health of women and communities through evidence-based intervention. Join us in rebuilding lives and restoring hope for women and girls in our country. Thank you very much.
Everyone, welcome Dr. Ellen to come up and say a few words. Thank you very much, yeah. Thank you very much. It was quite a picture in the right now, would it? Thank you so much. Jose Rumsey, the Executive Director of Wrahp. That is really inspiring. And words of action. For too long, we have been in these rooms, here and across the road, and it has been an echo chamber. 30 years after Beijing, and we really need action. Thank you for those practical solutions. I want to talk today about interconnectedness and how Lydia Suni, our moderator, several years ago, invited Bosse and myself to participate in the implementation. Today, together we are strong advocates. Bosse doing the grassroots work. You know, you are Mama Grassroots and I am Mama Peace. Mama Peace and Mama Grassroots gets together. You can imagine what's happening. And thank you, Bosse, because you're quite right. It has to be an accordion effect. Working at government level, pushing down and pushing up from the grassroots. So we need that push up and we need the push down. As we go into talking about safeguarding and talking about safety in the world of work, just wanting to leave you with some information about the International Labour Organization that now has the Convention 190 that talks about safety from violence and harassment in the world of work. As advocates, we need to remind our governments about accountability. A lot of governments rush to sign these conventions, but the practical implementation, adherence, and monitoring is missing. Lastly, to say, I proudly wear my insignia of office as the president of the Medical Women's International Association. And some of what Bosse has so eloquently described, my colleagues as medical women and medical practitioners sometimes miss sexual and gender-based violence when it walks into our clinics and consulting rooms on two legs. Oh, I broke my arm, or I broke my leg, not realizing possibly an intimate partner has pushed one down the stairs. So currently, MWIA is part of a recipient of a Gates Challenge program, and I have with me here, just give away Deborah Gordon from Harvard, and we're working together on improving global women's health by training and retraining online. So thank you very much for this opportunity. We can do this together, and I always say, how do we do it? With our elbows locked. Thank you.
And now, I'll turn it over to Dr. David.
Yeah, I'll share the screen.
Thank you very much, David. It's a real honor to be here. But say thank you for having me. One of the frustrations of being an academic is can be really indirect. So being here with people who've been in, as you say, in the trenches for so long is really humbling. And it's amazing work that you're doing. Thank you. So I guess I'm here as a manifestation of Bose's kind of vision going forward for Wrahp, rather than where we've been. And it's really great to hear her several times today say the word data with human rights, with happiness, rather than kind of a side glance. So I want to talk a little bit about a mindset about data and what we've been kind of that you may be talking about moving forward in terms of gender data. So data, not really, I'm hoping, a naughty word. What slides up here?
Yeah.
Oh. You want to just follow my screen here and
Okay.
there's a lot of that around. We live in that age, of course, and it's not, necessarily the first thing that you think about when you think about activism, right? I mean, we see things like this from the UN and others, right? That when we're talking about standard setting, when we're talking about effective implementation, indicators are essential, and as the spouse of a female medical provider, I know that tests in medicine are essential for monitoring and implementing care, right? And they are for us, I think as well. Surely.
Yeah.
All right. So I just want to go through some ideas. So recently, the African Union has a convention on ending violence against women and girls. My, I guess, person I know on the committee tells me it's about 6 weeks from the official language being released. This is from the November draft, right? But we see here in Article 4, the parties are supposed to regularly undertake research, quality data collection, and analysis on all forms of violence against women and drivers, support evidence-based law, monitor and evaluate the implementation of the convention. I think we're
Okay. Yeah.
okay. We on 15?
So I just want to share with the
I think we're waiting for Zoom.
yeah. So we're on Zoom. Yeah.
Go to the next one. And in Article 15, conduct interdisciplinary studies to collect and analyze the status and challenges, right, in violence against women and girls, and to help monitor things. So one of the questions Bose gave me is, how can gender data improve programming at the grassroots level? And it's really a lot to do with things that we know, right? Assessment. What are the needs? How do we assess our needs, right? How do we assess outcomes, right? Anecdotally, it's not a great way to do it, right? Budgeting. You expend money, right? You get evidence-based feedback on expenditures. Fundraising can be a double-edged sword that I've heard from a lot of NGOs that you can use data to communicate successes. You can increase your transparency with the donors, but at the same time, if you have a program that doesn't work and you're transparent about that, that might cause something that might impede flows of fundraising. But also information sharing, collaboration on common standards with other organizations, collaboration about what the needs and outcomes, for example, that you've seen, best practice sharing and co-development. And when I think about assessment and needs and outcomes, so I'm primarily a teacher. I've been teaching college. This will be 30 years this year. And I think about like what makes a really good teacher. And one of the things I think that I've learned is that you never assume what your students know. You don't assume what they know, and you don't assume how they know things, how they learn, right? That is, you meet them and you do little things to figure out what they know so you can meet them there. And I think that's the same thing with organizations, right? And businesses as well, right? You don't, assume you know what your clients are feeling, experiencing, what they know. You need to kind of take that in, right? In medicine and a domestic violence shelter and a substance abuse shelter, right? And data are very important for that. And I'm not talking about kind of giant data out there, in the world, but kind of grassroots data. And so the question becomes, for me, what gender data are necessary kind of fighting capabilities and existing inequalities, which is kind of a form of the second question Bose gave me. We have things out there. There's a lot of good stuff like the Gender Data Network, International Parliamentary Union Online, women's political rights and their representation. These are big places. World Bank, right, has the Women, Business, and the Law set that's out there and the developmental indicators. UN Women now has some kind of lists of laws online. Women's Rights Recommendation and Compliance Explorer shows kind of a rough estimate of how countries react to CEDAW comments. But from what's missing, I think really comes to need. And that is that the extent to which women's lived experience, that is, their experience of their own lives isn't represented. And this is important by widely available, reliable, valid data, is the extent to which they're left out of the fullest possible accounting of human dignity. I've been involved in the data business for over 30 years, and a lot of it is so top down. And I've been part of that. Like people get together in a room. I've been in some of these rooms on this street deciding what data we should collect. We're in a room, let's decide what stories are we going to tell about these people. And it was great for a while for me. And then at some point, it was like, well, what do those people feel about what we are saying about their lives? What's their direct view about their lives? And these data on a wide scale, in a systematic fashion, really don't exist. I mean, you want to talk about high level, like attitudes, support for democracy, feelings about like macroeconomic inequality and things like, sure, we have those things. But we don't have, data that might be helpful for other persons. Can we go show up? I'm just going to cut to the chase here. If we go to the lived experience, right? So, for example, would you be afraid to tell a police officer you're being abused by a male partner or relative? Do you feel your country's laws are clear regarding you? We've heard the word law, like, okay, there's a law, right? And then there's the implementation of the law, but do you understand the law? Like, would you know, even if it was enforced, would you know how to access that framework of justice? Do you feel safe from harassment on social media? Social media being one of the, real big realms now of harassment. And so, there's a big demographic and health surveys done in many countries around the world that has a lot of these kind of co-sponsors, maybe one or two less now. But they've got almost 400 questions. And, there's only one item out of 362 that talks about lived experience. Would you feel comfortable contacting the community institution for help if you're being physically, sexually, emotionally, or economically abused? Yes, no, or don't know. I mean, they do collect some stuff for depression, instrument, and feelings of shame regarding HIV status. But this is really the only one. Would you feel comfortable accessing the system, which is a big deal, and we need that. We need that kind of grassroots, individual level lived experience data. And there's a number of reasons, where we should do something with this. There are challenges. So for example, scalability. There is a digital access gap. I found a foundation that said 60% of women in northern Nigeria lack internet access. I found one today on the way in from Internet Society that said in Nigeria it's about 66% nationwide. So, okay, well, if we were to use technology to help, like the app that Vidya and Bose put together, what about the women that don't have access? Getting them access is one of the parts of the problem that we need to do, right? The number of civil society organizations that are needed. You need to have the networks to put, apps in people's hands, put surveys in people's hands. So there's, that's expensive and it's a lot of work. Funding is always for everything. We have surveys in the world, but why don't we have some for women that are longstanding? Why are they not longitudinal? Well, one is you need a stable data organization. You need some people who are committed to it, and that's their main thing that they do, and they're going to stick with it. Not that they're working on this particular grant, they're going to do the short-term survey, for a year. Funding, of course. So the idea, that I had to talk about is this, right? A gender data system where women stakeholders at the individual level decide what stories do not get told in the data. How so? So women living their own experiences are the ones who decide to tell their own stories, which I think sounds like common sense, but it doesn't happen a lot, if at all. Across national longitudinal data set, this is a more ambitious kind of thing, right? Telling these stories from the vantage point of women's experiences. And I think that, the technology that they've used already on the gender violence reporting app is something that could be harnessed to do this. I mean, there are inferential issues, it's convenient sample and so forth, but there are ways to get around that kind of stuff. And so, I mean, it takes more than a system, it takes movement. I really think this way. So up for discussion, are these things, is it a worthy goal? Where would you do the proof of concept? Who are your stakeholders? How can you guarantee privacy? Very important. Partners, and how can you deal with the inferential issues to do with it? So I hope we can have some discussion about that. And thank you so much. It's an honor to be here, really. Thank you.
Now we turn it over to Felucci.
Thank you. I'd like to stand. Thank you, everyone. I said my name is Oluchi Hedero, and I'm the national representative for the Safeguarding Resource and Support Hub project. We are implementing in Nigeria as well as in other 11 countries across 4 regions: the MENA region, Eastern Europe, Africa, and South Asia. So interestingly, this is my first time attending the CSW convention. I'm very privileged to be here. And since I came, I've been attending sessions in various rooms, right, across different centers. And I've heard similar themes that are being discussed. And this center around women empowerment, women's justice, women's equity, fighting and kicking the patriarchal system we have, getting the place for women in the society. Now, all of these are very important, right? And they are all very key for establishing the agency of the woman, right, in the society. But one key thing I want to emphasize on is some of these things are factors and issues that the women have to face from outside, external factors in the family, in the community, at the places of work, all the places that they find themselves in while navigating through life on a daily basis. Now, the question and where the gap is this: what happens to the issues and factors that face these women internally? When I say internally, I'm looking at amongst us feminist organizations who are working to establish the focus that we have for the women. Talking about power imbalance. Now, when I say power imbalance, I'm looking at situation whereby the organization is placed here, and the girls and the women in the society are somewhere there. You can put it on any cadre. But we know that the organization is here. Why? Because they are there to provide that need that the women and the girls have. To what extent will we manage and handle this power to ensure that they are not abused? That is where we come in. And that is the issue around safeguarding. How do we manage power and power dynamics and the power we have as the organization, as the feminist institutions that are there to support these girls, that are there to protect them from those external factors that they are facing? And on this note, as we already established our agency, I can say you should call me Mama Safeguarding. So my organization works with organizations, especially local organizations at the grassroots level. We've already emphasized on the need to work with local organizations because of so many factors, right? And please go back to that slide. As an organization that works effectively with local organizations, our focus is on supporting them, both those in humanitarian and development sectors, to strengthen their safeguarding policy and practice against sexual exploitation, abuse, and sexual harassment. Not now those from their community members, but from yourself, your community volunteers, your interns, whoever it is that has any reason to interface with the program participants on behalf of your organization. The suspect, forgive me, but he is a suspect, right? And so we are working to see that the right systems and practices, it doesn't just start and end with having safeguarding policy, but ensuring that the right systems are in place to make it a living document and putting it into practice to safeguard everyone. We are committed to being collaborative, talked about partnership, collaboration, networking, right? And that's kind of the basics of our work. And we are driven by the needs of less resourced civil society organizations. David spoke about lived experiences of these women and girls. It's very salient, and we pay attention to those needs. So our services, our implementation and support are needs-driven to meet the needs of these people as they come up, and we ensure survivor-centered approach. So our organization is a global multilingual, multi-country organization that also provides support in multilingual online platforms. Next slide. Go ahead. I've already mentioned this. We are here in Africa, and we have colleagues from the other parts of the country, 12%. Now, how do we do this with local organizations? Our approach is on CSO, civil society organizations, with low income and are in fragile context. Those in conflict areas, and those who are dealing with natural disasters and other issues that are there. And we work with partnership and collaboration. So our strategic priorities are based on evidence from a country assessment, still drawing back to needs-driven approach. So we did a country assessment at the start of the program in 2020 to understand at what level does the country have peculiarity on safeguarding issues. And that gave us the data, right, that helped us in developing the model that we use in supporting those organizations. And then we do tailored, contextualized, and translated blended support approach. We have a website that has resources, tools, and templates on safeguarding that is user-friendly for every organization. And these are translated into a lot of languages. I think we have about 18 languages on the global website. Yes. So every country, whatever language, of course, is between the 18 languages, can easily access these resources, and they are all there at no cost. When we started in 2020, Dr. Eleanor always said that we are flying the aircraft while building. It's a very serious and strong why is it? So I always like to emphasize on that. Why? Because when we started, we had very selective access and availability of resources, materials, information on safeguarding. I'm sure some of us will say, what is this safeguarding? I'll talk about it. So those documents were very scarcely available, but now we have a rich bouquet of resources on our website that are all available at no cost. We cannot effectively implement women equality, women empowerment program without providing a robust, holistic, and overhauling approach to it by tackling both internal and external issues. Okay, go ahead. Now, I just have this data, talking about the impact of data, right? To showcase the impact that we have as we have been implementing in the various countries that we have. But this is Nigeria data specific. And we started in 2020. We had the first pilot implementation between 2020 and 2022. And that yielded lots of improvements on safeguarding. And with that, the donors were impressed. And we were called back to implement the second phase of the program, which started in 2023, 2025. And so as you can see here, I mentioned earlier about the online websites. You can see here we have so far gotten over 17,000 visitors to the Nigerian Hub website who have been accessing the content. We will have lots of success stories on this. And then 96% of these users are from Nigeria and are happy with what RSH offers. So a lot of these data you can see are all positive. And they are showing progression, right, on what has been done so far. Let me go to the next slide. Now, safeguarding our gender equality and empowerment effort. That is why I'm here for CSW 69. I am here to advocate for effective mainstreaming of safeguarding in our gender programs. If you don't get anything from me today, please get this one. That is need for us to actively and consciously integrate and mainstream safeguarding in our gender programming. Now, what's safeguarding? And I have here, it means taking all reasonable steps to prevent sexual exploitation, abuse and harassment, and other forms of harm from occurring, and to respond appropriately when harm does occur. So it's not just about policy, it's not just about having reporting mechanisms, It's not just about throwing out phone numbers to the community. Call us if you have any problem. Reach out to us if there is any issue. What about responding when they reach out to you? A lot of people find it difficult to reach out when they have issues because of so many problems. Now, I send some organizations, you say you have multiple channels for reporting, and year in, year out, you don't get any reports on sexual abuse issues and all those intersecting factors. It may be that everyone is safe. It may not be. Now, if it is not, what is the problem? So it might be that the reporting channels you have are not living up to the expectation of the potential users. They might not have confidence in what you will do when they report to you. They might not know what to expect from you. Talking about feedback, the need for us to provide feedback when we provide those supports. So simply saying, safeguarding means making sure that we do not harm people we come in contact with during our gender programming and emphasizing on it because that is why we are here. Okay, there are several roles that safeguarding can play for effective gender programming in keeping people safe. I have here the first is preventing abuse and harassment through awareness training, providing support for survivors, strengthening community-based approaches, establishing clear reporting and response mechanisms, which must be accessible, confidential, and safe. Implementing robust monitoring and evaluation can't just keep going forward. There is need for learning and improvement. Promoting accountability within organizations. The leadership should model the right standard and they should take the lead in this. Creating a safer and respectful environment for all to thrive. Collaboration and advocacy. We talked about collaboration. We can't do it alone. We have to infuse. We have to lock our elbows, like Dr. Eleanor said. We need to intentionally lock our elbows to work in partnership. Now, another good news that I have to share for you is that RSH is gearing towards sustainability. We know how programs come and go. And at that level, some people are usually left high and dry, especially in the community, and they're like, what's the face? What's the future for us? What's our fate? And filtering in this, RSH is working towards localization and sustainability. And of the organizations that we worked with and mentored through the process to strengthen their capacities on safeguarding implementation, which Wrahp is one of them. And through a rigorous process of selection, we have Wrahp taking on the process to foster efforts in Nigeria and safeguarding. I am saying this so that you hold on to her, don't let her go, so that you get access to all the information, access to resources, tools, and templates that you need for your safeguarding journey, whether it's at the starting age or the middle stage or the advancing stage. You have all you need at our website. And I've put in here the QR code just to start the process before you start to hold her. Let's start with you logging on to this. And if you don't mind, please get our phones to scan this QR code that will take you directly to this website. There we have, no, please hold on.
Yes, I want it on.
Okay, thank you. There we have an e-learning module on safeguarding. So it's a safeguarding course that you can as well undergo on this website at no cost. And you will as well access your certificate of completion on this website, as much as webinars. We've had webinars on strategic safeguarding topics, issues, and how they concern organizations. We have all the recordings there. You can as well access them. Please, here you have the QR code. And in conclusion, I'd like to say that safeguarding is everyone's responsibility. It's my responsibility, it's your responsibility, it's our responsibility. It's irrespective of our sectors, our constituencies that represent, the program we are implementing, and whom or the society we fit in. And so this is a call to action in line with acceleration for action. Thank you so much.
Thank you so much, Amy. And we would love to have some discussion and learn from you and learn from everything that you're doing and how you took all this information in today.
So anyone in the room, any questions, any feedback, any comments? Yes, please.
There, thank you so much to all of the panelists, all of our speakers who are so eye-opening. Because of all of the things that have happened in the last couple of weeks, especially with the future of health and data collection. Pregnant women and breastfeeding women always face a lesser amount of data collection when it comes to healthcare surveying. And with the new list of terms that we are no longer receiving government funding towards, if your studies are kind of looking forward to those things here in the US, what do you all think that the future of data collection and women's health is starting to shape up like? And that can be looking forward, what you've experienced in those last couple of weeks, trying to reorient what you do. What is your immediate outlook looking like? Thank you.
Thank you for that question. Would you like to take that?
Sorry, but I do know you were talking about pregnant women and how it is possible to further understand what they are going through, right? Well, unfortunately, if you go to some countries, they don't prioritize the health. They rather spend so much money on defense and maybe structures and all that. But from our point of view, what we have started doing is to create pockets of women who support women within the community, all right? And so when a woman, I will ask a question. If a woman is in labor here now, every one of us will want to support her. So beyond that, we're also saying within the community, let's try as much as possible to support other women to get that kind of support that they need. And then recently we are starting a project working with retired nurses who are retired but not tired. Okay, so the women kind of interact with other women in the community and see how well they can understand what is going on and then help to refer. Because if you go to government hospitals, nothing is happening. They spend all whole day. I'm not saying totally, maybe about 80% of things not happening. 20% is not enough for the kind of population that we have. But beyond that, I'm saying that CSO needs to be creative. NGOs need to be creative in terms of identifying the resource we need, of how we can help our women to, to have a vision. And then we work with these women to make sure that we collect those data of various issues that are happening in the community. Thank you.
Yeah, I think, put my political scientist hat on that. I think it's going to be more difficult in the coming years to collect data on human rights related affairs in the United States. And about that, how to fix that. Well, I mean, there's certainly going to have to be a response from private philanthropy, right? Try to fill some of those gaps, but it's impossible. I mean, that's the bad news. I mean, the good news is that the United States is only one out of 200 something countries, right? And so, we can look at programs like Wrahp who would be affected by that. But we can also look at countries, that have less than full enthusiasm from their central government, how they operate, how do the civil society organizations in these countries operate, and maybe Jose could talk to you about that as well. I mean, in terms of the government of Nigeria, I mean, my experience is more in Palestine than Nigeria, but there are ways that groups get through government interference, and I think the United States is going to have to look out for these lessons. That said, it's still a time where we can kind of pivot away from, talking about the gender data gap that we've been talking about for 20 something years and start planning to do something about it. I don't think US federal funding is going to really affect those discussions, and technology will certainly help aid the fiscal problems with some of that. But yeah, it's gonna be tough in the United States, but I don't think we need to stop talking.
Yeah. In the room that I just came out from, someone said something there that struck me. He said, the AI that you have there did not fall from the sky. It is an infusion of the information that people have made available over there, right? That it has. Well, what am I trying to say? How do we generate data? How do we do this data drive enforcement? It is by all of us charging ourselves, right? To utilize the systems, the platforms, the opportunities we have to make this data known. Someone said that cardiovascular disease centers only on men. It's another new information. I think this is the first time I'm coming to say it, but I'm absorbing lots of things that it's only available on the side of men. We do not have that for women. Why? Don't we have women suffering from cardiovascular diseases or disease? Yes, we do. But the data is not there. How can we get the data to become conspicuous? By making it available through the adequate platforms and channels that we have over there. And I think that's what I can say. I'm charging all of us to utilize that platform. Thank you.
Thank you for that. Anyone else? Questions? Comments in the Zoom room?
No, no.
Yes. 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 Oh.
Wonderful session. I just happened to pop in. My name is Rayma Hooper. I am the United Nations representative for the Medical Women's International Association. I'm also a third-year undergraduate student at the Lehigh University in Bethlehem, Pennsylvania, where I'm studying community and global health and molecular biology. And I have two primary questions for you that I'll probably just overlap. You made a really insightful comment saying that governments tend to prioritize funding towards defense as opposed to health, especially women's health. So my question for you is, how do you partner with the government if they do not want to invest any or like certain funds and prioritize that?
Okay, so thank you very much. That's a very critical question. So it requires a lot of advocacy. It requires about looking at the laws and bringing their attention to what's there in the law. Most times the laws are kept, away from the community, and also engaging and building a critical mass of community people to demand for resources being put in that area. I do know there are some organizations that have monitored resources that are put into health sector, into the political space, into the defense, and we know very well that most money are there. But what we can do, and I think we are doing, is to constantly bring their attention to the fact that this needs attention. For example, when we carry out data and share with them, we constantly partner with them. For example, the state I am has a good political will. Lagos State has a good political will on issues of SDV. But that does not mean they are they have gotten to the level. For them to have the law, and then they went ahead to have an agency that speaks to SDBV, and they are putting resources there. We support with other funders. They are friendly to funders who want to support them, and that makes it good. We have other partners who have also worked in that area. So working with government, for me, it's working at the grassroots and building a critical mass of people, advocates who are going to be speaking about the rights of women to health. And once you did that, so we are going to be challenging them when they come for elections, when they want us to vote them into power, and we are asking them what happens to our hospitals, what happens to going to school. If you go to public school, there's no public toilets. Children queue up for to be able to use toilets and all that. So we have to hold them accountable. And then again, of course, you know that they have what we call giving up the holding us, we our organization accountable. We must also try to be accountable to the community people. And in doing that, they also have to be accountable to us. So it's a mutual responsibility. And I want to say we shouldn't allow that to happen. I still believe that building critical mass of women rights organization, because we are the one who goes to the labor room. We are the one who is pregnant. We are the one who also knows these children. They are old. I'm sure if my mother is here, who is 95 years old, and she sees me, she still wants to carry me on her laps. So we need to fight for not just young women, also older women, and all that. Thank you very much. Yes. Yes. Am I not shy? No, you shouldn't be shy. My name is Uchenna Doko. I work for Center for Gender Economy in Africa. My name is Uchenna Doko. I work for Center for Gender Economy in Africa. I have two things to say. First is to agree about gender and data. I think the difference between developed countries and developing countries is data. Because you need data to plan. If you don't have data, you can't project, you can't plan. And that's why most of the planning in developed countries like mine is done ad hoc. This has happened now, emergency, and then we quickly run there and meet the needs and that's it, without anyone studying what happened, why did it happen, what's the potential that will happen again, how can we put plans in place. If we ask us right now, but we have a lot of things also being done now to measure issues around infant mortality, maternal mortality, and the rest. Such data help government to budget. Why government always budget for things like security? It's because there's a lot of numbers coming. We lost 11,000, 100,000, and then they can project a budget. But if we keep saying women are being abused, women are raped, so in numbers, from 2020 to 2025, how many? What happened apart from COVID, recovery from COVID? What else happened? And then it will help to plan for the next 5 years, for the next 10 years. And then that's calm. But a lot of developing countries, there's no calm. Things just happen and we react. Right now, we have a lot of things going on around sexual harassment, even in our among our political class. And then we're not even measured. We're not even thinking about the future, what can happen. If they can deal with her, they can deal with who else. So I think it's very important that we liaise to communities, national data bodies to keep measure. And then it's left for us, civil society, to now make it usable. Get it to the level where we can interpret or even take one line of it and then ask for budgets for planning and then proper solution. And then secondly for me, it's what Mama Peace brought up. C190 by ILO is a very beautiful policy, but it's not popular. It's not popular. Almost all the organizations to get a good tick have gender policy. So some have safeguarding policies. But how many of them have signed on to, or even know about C190? And you have households, you have institutions, and you have the government. Most people that work in private sectors are from the households. And then they get abused and households will bear the burden. And then who else, it's at the institution level, who is responding? But we have this beautiful work that
have taken ILO time to build, and our country has signed onto it. What are we doing with it? We need to popularize it. We need to look at those reviewing policies, gender policies, and making sure that if you have a gender policy, then C190 should be part of it. So funding, even putting it in different formats for it to be understood. I used to tell, because I consult a lot with the UN agency, some of our documents are too classic. It's too tough for everyday activists to use. So sometimes we also think about these everyday activities that will popularize this document and maybe have the big or the very classic version and have a simpler version. I think I've tried to. Thank you so much.
Thank you.
One last question. Yes. No, not one. Two. Oh, three. Did I see your hand? Four.
Thank you so much. Mine is actually not a question. Mine is a comment to say that I want to thank Osa and her team, Wrahp, for the incredible work you are doing. One of the organizations, about 100 organizations that have funded, we granted. Okay, actually, I work with, my name is Echini. I work with actually Nigeria as a business development and innovation director. But then I had also worked as a women's rights manager, got my for over 8 years in doing that work. So yes, so Wrahp is one of the 100 women's organizations that we have funded and hope to continue to work with. The work we are doing is amazing. We appreciate it. We see it. We value it because we are at the community level and dealing with issues at that community level, which is very important, which is very strategic. And then we also see people for, and not just coming alone, but the fact that we come with other young persons to this place is an indication of who we are and the kind of things we are doing.
Thank you. Thank you very much. My name is Sylvia Woko. I work with Safeguarding of Hub. I work with Aluchi here. And I just want to say, of course, like every other person, it's been amazing. But from the safeguarding perspective, I just want to quickly point out one aspect of safeguarding that I think is very important and we should be intentional about it, and that is about safe communications. I'm this communications officer for safeguarding, so of course I have to point that out. Media, of course, is very good and it helps in so many ways for different work that we do. For example, it improves our public image or organizations and shows accountability. It helps us to raise funds and so many other things. However, there are some safeguarding risks associated to media communications. And so, for example, the communication maintains the dignity of the beneficiaries or the people in the community. Talk about things like protect your privacy. About that earlier. You have to get proper consent for you publish certain things, because sometimes it can be so appealing to the funder because you know you've got funding, but however it has come from the approach of the survivor. Is it okay with them to get consent? So many other things. And just to say that on the hub, just like we had mentioned, we have a story of resources to help you put safe comms in all of the policies and all of the work. Thank you very much.
I forgot to mention other of our partners in Australia, we changed the logo of Center for Economic Capital Rights, and then Chrissy Group of you guys are here to say what thank you.
Yes.
Hi, my name is Larissa. I am the International Engagement Director for the Migration Movement Children Platform. I'm also a graduate student at Harvard Law, so kind of hear that. My question is about the weaponization of gender-based data. We saw in the US, I'm a US citizen, how there was some talk about potentially looking at the pharmaceutical histories of women and the data of that, and seeing if they've been taking birth control, if they ever had access to abortion pills, and using that to potentially criminalize women who have been doing this. So how can we protect women to like come forward and give accurate answers when they are answering questions about lived experience without the fear that they may be criminalized for the answers that they're given?
Good question. Somebody wants to say something, so maybe just allow. Yeah, the gentleman there.
Thanks, everyone. My name is James. I'm a program advisor at Community Life Project Lagos, and also the director of programs at the African Communities of Manitoba in Winnipeg, Canada. I have just a few comments. First is to say that Bosse has been on this journey for decades, and was my former colleague, and I'm not surprised what she's doing. But I also want to build on that sometimes when we gather in this forum, we talk about what needs to be done. We don't talk about what we ourselves will do. And Bosse is one of the people who have demonstrated that in our own capacity, we can do something. The second is the opportunity now to change the paradigm of international conversation. This kind of forums we have should not be side forums, because those who are actually implementing these big policies are the ones we need to listen. So we come up with international instruments, we have laws, but those laws mean nothing if they are not implemented. So I think that we also need to place PSOs at the community level at the higher stage where they will inform policies. And I think that is, I'm hoping that the next forum would not be the side session. It should be the next session of it. The other comment is on research. I think this is the time for questions. Who drives research? And that's why we are worried about where the funding is coming from. Because usually, those who have the money tell us what should be studied. Oh, we need to change that paradigm. We are thinking human beings are subjects. Women should be studied because the women themselves need to be part of that process. And the reason it's not happening is because that process at the community level takes time. Sometimes the data you're looking doesn't come overnight. It takes time. And we are not willing to take time because we want to collect that data. So I think that that's also something we need to say, who priority drives research. If it's whose agenda, if it's the women's agenda, if it's the youth agenda, then the funder, we can look for funders. But when the funder brings money and says, study rape, study women, I think women are objects. I think we need to start changing that. That's just a few comments I want to make.
While she's coming up, I just want to very quickly mention something. 5 minutes based on what the gentleman has shared. There was another panel that I hosted on women entrepreneurs, and Shannon Paris from Sri Lanka, who was responsible for one of the largest global polls on human rights and democracy. She was talking and shared this idea of the great recontestation. And you sort of pointed to that. And what that means is right now, many of our fundamental rights and freedoms are being questioned and challenged across the board. And this is an opportunity for us to reconsider, reconfigure, and re-navigate these different pathways, these different systems. And it's, I think, a real interesting opportunity for us to go from the sidelines into the main house, as it were. And there is a way to do it together. So just wanted to mention.
Thank you very much. My name is Nabayomi Ward. I'm the CEO Global for Women and Children Foundation Blog, Nigeria. My sister Bosse, I want to say well done for the great work. She's such an amazing person. She doesn't hold information. She shares information. And on this note, I want to say there's something we also need to do as colleagues, as women rights organizations. We should encourage something like community of practice, where we have peer learning, where we have sessions where we can learn from each other, we can adapt what is working in one place and see how we replicate in other areas. This is something that we can take away from Bose, from the good work that she's doing. And beyond that, I want to also respond to my brother who talked about the research. I want to say, using the feminist approach, actually supported a lot of organizations to do one of the two things, working with the grassroots to get information, to get data. And it's an approach that each and every one of us can adapt. Because when we do it, putting the community people in the center, we'll get more results than taking it from, when we take it from bottom-up approach, we get a lot of results. Thank you very much.
Okay. We have a question online.
Okay.
Yes. So please come, yes, after you, we will take the question.
All right, I'm Wendy, I'm from UPAP. I'm here to announce a very interesting benefit to youth for the low-income area youth. My colleague has invented a type of molecular growth agent. So for those areas that you don't have food, please allow us to let you know how to use that agent. We are planning on investing to the low-income area youth. I don't have all the time to tell you, but this is a banking and the agricultural crop program together will help families have child 11-year-old and above start having banking accounts because of the growth of the crops. I will not take more time. I just want you to do that. There is certain solution definitely for those mothers and the fathers or the youth that you don't see hope, but we see it coming, especially with our wonderful African mothers. Thank you very much for African mothers, sisters, for being diligent, teaching children the right principle. Thank you.
Thank you. Thank you. So the question online is, what are you doing to engage men and media in your work towards gender equality?
Okay, so thank you very much. Men are very strategic in our programs, and that is why we have trained 3,000 men across various communities as advocates. And we are not going to stop at that, because when we started the project 17 years ago, we actually did a cross-cutting, working with men and women. And the men was like, well, why did you invite me here to talk about gender based? She's my wife and I paid her bride price. But down the line, they started asking questions because we made them to realize, do you have a daughter? Do you have a wife? Close your eyes and tell me what you want to see those children be in the next future. And you see some of them say, I never thought of it like this. So the men, in some way, they're also victims. And people are asking, who raised the men? So we are trying to say, okay, let's work with families. Let's change the narrative in the religious context. Let's change the narrative with the traditional belief system as to what power that is given to the men. And when you sit down with the men and talk with them, you see them feeling very comfortable to talk with. It's a long process. It's not just something you do just like that, but it is working. Working with the men, it's something it's very critical in part of our programs and thematic areas that we work. Thank you very much.
I want to add to that, I've had the privilege of meeting in person many of the male community leaders in Lagos that work directly with Wrahp'. And I was just so struck by their passion, their commitment, and their deep insight into the space. I mean, they are not showing up to be there. They're showing up to make a difference. And for each and every one of these male community leaders, it's personal. And that's because of your leadership. And that's because of what they have learned from Wrahp'. And we all know that that is a very complicated journey. That is not a simple journey. And you're delivering that day after day after day. So I learned this when we went and launched the NCARE app. I was astonished at the number of male community leaders in the room so vested in the process. So with that, I'd like to wrap up. We are out of time.
And if you would like to offer some closing remarks, closing?
Okay.
Thank you.
So I think I need to stand now. As a happy woman that has come to the CSW and see faces and people commenting on what we have done here, I want to say that I cross my heart. This is just the starting point. 2025 is just the beginning. We are going to do more, especially coming in as the local ethnic partner in safeguarding. I'm telling you that we are going to take it higher. And I want to beg every one of us here. There are little ways you can help. Information, opportunity for more funding, opportunity to partner with us. We are willing and happy to get those information. And I want to say thank you so much. I cannot stop but recognizing my sister who started the journey of NGO with me. She's here, she doesn't like publicity, but I will talk about it. She started this journey with me please, you need to stand up. Yeah, thank you so much, because she actually came specifically because of me, because she felt I need to support you, I need to let you go. And all other sisters that are here, you know now, we continue to rub the work together, yes, we partners together. And I need to thank my brother David and Oluchi. Thank you for what you do, and it's forever. This relationship is forever. And my sister, it's our organization, so we'll continue to do the work with you. Thank you for coming and doing. And for those, everybody online, thank you for being there. We hear you, we see you, and we'll continue to get in touch and let everybody know that the issue of sexual and gender-based violence is everybody's business. Thank you very much. And again, I want to also not forget, please come. The young girls that are in my team that came here, and those of them in Nigeria, I want to say thank you. I am the powerhouse, and the women in tech, and the M&E officer, I want to say thank you very much for your support and all that. And for other funders that have funded us before, Action Aids, and every other one that is going to support us more. Thank you so much. Come and stand. Thank you. Please come. The guru in communication. Thank you so much. Yes, I think we should take a good photograph now, so that and then we'll take photographs with everybody. Thank you so much. And my sisters from every woman's city. Thank you so much for your support. Thank you.
Yes.
Okay, if you want to come, please join.
Mama community.
So we have a name that we are known for. We say you see something, you say something, and do something immediately.
Okay.
You don't have to wait.
Oh, yeah?
See something, say something, and do something immediately. Can we all come? Let's take photograph together. Please. And that will be. Thank you.
Yes, ma'am.